Easy steps to banish plaque and avert cavities. In this video, crafted for dental patients interested in improving their oral health, we'll explore easy and effective strategies for removing dental plaque and preventing cavities. Our aim is to provide insightful yet straightforward advice that empowers you to take control of your oral health without any confusing jargon. Let's get started. Dental plaque is something we all encounter, but what exactly is it? Simply put, plaque is a sticky film of bacteria that constantly forms on your teeth. While it is natural, failing to address plaque buildup can lead to more significant problems like cavities and gum disease. This video aims to arm you with the necessary knowledge and tools to combat plaque efficiently. Ignoring plaque can result in severe dental issues. When plaque isn't removed, it hardens into tartar, a calcified deposit that can only be removed by a dental professional. This can lead to gum disease and cavities, potentially requiring extensive treatments. Understanding these risks helps underscore the importance of managing plaque daily. Incorporating specific daily routines can significantly reduce your plaque levels and prevent cavities. Let's delve into these habits, focusing first on brushing. Brushing your teeth correctly is the cornerstone of effective plaque removal. Start by selecting a soft-bristled toothbrush, which is gentle on your gums while effective in cleaning teeth. Use toothpaste containing fluoride for added cavity protection. The recommended technique involves holding your toothbrush at a 45-degree angle to your gums. Use gentle circular motions to brush all surfaces of your teeth, front, back, and tops. Remember, brushing should take at least 2 minutes. You might consider setting a timer to ensure you're thorough. Fluoride is key when it comes to selecting toothpaste. This naturally occurring mineral strengthens your teeth's enamel, making them more resistant to decay. Make sure your toothpaste has the ADA seal of approval, ensuring it meets standards for safety and effectiveness. While brushing is vital, it can't reach every part of the tooth, especially the spaces between them. That's where flossing comes in. Flossing once a day removes food particles and plaque from areas your toothbrush simply cannot reach. When flossing, use about 18 inches of dental floss. Wind most of it around each middle finger, leaving an inch to work with. Gently slide it up and down between your teeth, curving it into a C shape around the base of each tooth and going just beneath the gum line. Avoid snapping the floss, which can harm your gums. If traditional flossing doesn't work for you, consider alternatives like dental picks or water flossers. Dental picks are convenient and user-friendly, while water flossers use a jet of water to help remove plaque and food particles. These methods can be particularly beneficial for those with braces or bridges. The food you eat plays a substantial role in your overall dental health. Sugary and acidic foods can erode your teeth's enamel, so it's essential to monitor your diet. High sugar intake is linked to the formation of cavities. Bacteria in plaque feed on sugar, creating acids that attack tooth enamel. Try to limit your consumption of sweets, and when you do indulge, brush your teeth afterward if possible. Instead of sugary snacks, opt for foods that naturally clean your teeth as you eat. Crunchy vegetables like carrots and celery, cheese, and nuts are excellent choices. They help produce saliva, which washes away food particles and neutralizes acids. Even with perfect at-home care, regular dental visits are irreplaceable. A professional cleaning ensures that any stubborn plaque and tartar are removed and potential problems can be caught early. To maintain optimal oral health, it's recommended to see your dentist twice a year. These visits involve thorough cleanings and comprehensive examinations. Your dentist can identify early signs of potential issues, allowing for timely intervention. Knowing what to look for between visits can be pivotal in maintaining oral health. Gum sensitivity, persistent bad breath, and tooth discoloration are potential red flags. Always report these symptoms to your dentist during checkups. Professional cleanings are more thorough than at-home care. Dentists use special tools to remove plaque and tartar buildup that brushing and flossing miss. They can also provide personalized tips to enhance your oral hygiene routine. A typical dental checkup might seem daunting, but knowing what to expect can make it easier. Your dentist will conduct a visual examination and may take X-rays to get a complete picture of your oral health. Regular evaluations help in spotting issues that aren't immediately visible. While daily brushing and flossing are crucial, other preventive tools can bolster your oral care routine. Incorporating an antibacterial mouthwash into your routine can help reduce plaque and fight gum disease. Swish it around your mouth for about 30 seconds after brushing. Not only does it reach areas that your toothbrush might miss, but it also freshens your breath. Chewing sugar-free gum significantly boosts saliva production, which is beneficial for your teeth. Saliva washes away food and other debris, neutralizing acids produced by bacteria. Pop a piece after meals when brushing isn't possible. It is widely known that tobacco and excessive alcohol use harm your oral health. These substances contribute to tooth decay, gum disease, and even oral cancer. Reducing your intake can significantly improve your dental and overall health. Dental sealants offer protective barriers against plaque and acid buildup. Applied by your dentist to your molars, sealants fill in grooves where plaque tends to build up. While anyone can benefit from sealants, they are especially recommended for children and teenagers. Each person's oral health needs are unique. Customize your daily routine to address your specific concerns. Discuss with your dentist to develop a tailored plan that aligns with your lifestyle and needs. Encouraging your family to engage in proper oral hygiene sets everyone up for a lifetime of healthy habits. Establish a collective routine and make brushing and flossing a shared family activity, particularly with young children. Dentistry is a continually evolving field, with new technologies and treatments emerging regularly. Keep an open dialogue with your dentist about any new procedures or tools that could enhance your dental care. Many communities offer health initiatives, such as free dental checkups or educational workshops. Take advantage of these resources to better understand and access oral health care options. It's easy to overlook the importance of regular oral care, but maintaining consistency in your routine will yield long-term results. Healthy teeth and gums contribute to your overall well-being, both physically and emotionally. In conclusion, let's recap the essential points discussed in this video. Understanding and managing plaque, adopting proper brushing and flossing techniques, making tooth-friendly dietary choices, and maintaining regular dental visits are vital. These measures together form a robust defense against cavities and gum disease. Now is the time to take action. Schedule your next dental appointment today and commit to revising your oral care routine to include these daily habits and preventive measures. Thank you for joining us in this journey to a healthier, brighter smile. By following these guidelines, you're taking significant steps toward improved oral health. Remember that your smile is one of your greatest assets. Take care of it properly. If you liked this video, please give it a thumbs up and don't forget to subscribe to our channel for more health and fitness content. More videos can be found now by clicking the boxes that have appeared on screen. Please leave any comments you may have and topics you would like us to cover in our up-and-coming videos. Thank you for watching. Until next time, goodbye.